Hello and welcome to part 1. My name is Dr. Bodo Schiffmann and I would like to take you on a journey where you can become a dizziness expert, someone who is particularly knowledgeable about dizziness disorders. The whole thing is completely free and today is, as mentioned, the first part. So we are absolutely dealing with the basics, with the absolute basics, with the fundamentals concerning dizziness. I would like to briefly tell you something about myself for those who do not know me. Until 2020, I ran one of the largest private dizziness clinics in Germany together with my dear wife Bodo Schiffmann, who in addition to being an ear, nose and throat doctor is also an EMDR trauma therapist. And people came to us who everyone said they can't be helped, they're imagining it. So we made it our mission to take care of the hopeless cases, and these hopeless cases came. They came from all over the world, and when I say from all over, I really mean from everywhere. They came to us from all continents. And we found that many of them could be helped very well. It started with us trying to understand what symptoms the patients described to us and how these could be explained. And with that, one could use very sophisticated diagnostics to find out where exactly there is a dysfunction. There is no single dizziness and no single therapy. That means the first thing I need to find out is, why does my patient feel discomfort that they define as dizziness? And that is already the first step one must take. The patient must also start to notice that they are believed. I have always said that the patient does not need the doctor's permission to feel dizzy. However, the big problem for our patients has always been that you can't see it. You feel dizziness, but you don't see dizziness. And ultimately, that is a new beginning. I had a case in the practice where after the treatment, the husband, no lie, took out the wedding ring and put it back on because he had lost trust in his wife. We were the last resort, the last doctors his wife was allowed to see, because everyone told her she was imagining it all, and that is, as you can imagine, an absolutely dramatic story. And the terrible thing is, it doesn't just affect individuals, it affects many. And I've also experienced that it's an embarrassing topic for people. One doesn't like to talk about feeling dizzy and you can't really define it yourself. You might be afraid that others would think you're drunk or taking some substances. And the opportunity to inform a patient, to give a person understanding, to also bring them closer to the functioning of their own body or to explain the functioning of the balance organ, helps people to better assess situations. And when you assess situations better, then as with any routine matter, you actually have a good chance that the symptoms will go away afterward. Everyone is familiar with dizziness. Some of you say, no, I've never been dizzy, but I think everyone has experienced dizziness, like when you stand up too quickly, or you might know this. You sit on a chair, spin around quickly, stop, and then you notice that everything keeps spinning in your head for a while. But why is that? Is it that our body simply cannot comprehend that we are spinning in circles, especially when we close our eyes or dance? But just try what we are doing here. Close your eyes, spin quickly on your swivel chair, stop and enjoy this feeling a little. Just notice how long this feeling actually lasts. And now, once you've done that, imagine this feeling lasts the entire day. But no one can explain where it comes from. Standing is incredibly complex. Balance is incredibly complex. And when you are an adult, it is not like being a child anymore. A child falls and gets back up, but we are not used to that anymore. We once learned to walk, we once learned to stand, and suddenly it doesn't happen anymore. If a child thought as much as we do, it would probably never learn how to really walk. Dizziness is a trauma. That's why I mentioned that my wife is an EMDR trauma therapist. It is the strongest trauma Dizziness is the complete loss of control. This loss of control knocks you down. It knocks you off your feet. It tips you over. That's really what can be said about this topic. And with that, the patients are deprived of their foundation. And what follows after this trauma can be, for example, depression, because we need a trigger, and this trigger is almost always a loss of control, and dizziness is the total loss of control. You know it, oh God, I think I'm about to fall over, or something similar. And that is what the therapist or the relatives often do not understand, this feeling that is going on inside the person. And then he goes to the doctor, and the doctor says, well, is it a spinning dizziness or a swaying dizziness or an elevator dizziness? But he doesn't know at all. Maybe it's just a seconds-long feeling of emptiness in the head, like you have with a circulatory related heart rhythm disorder, for example. Even when in the case of a usually harmless heart rhythm disorder, a single beat is missed, you get a very brief feeling of emptiness in your head. Or as mentioned, you stood up too quickly and your circulation fails, then you also get a strange feeling. Maybe you see stars or something similar. And that cannot be described as rotational vertigo, elevator vertigo, or swaying vertigo. And then it goes further. Then the patient says, I'm afraid when I come to a crowded place. Then the patient immediately receives the diagnosis of agoraphobia, the fear of large spaces. And now, dear medical colleagues, especially neurologists, psychiatrists, and others, sit down, buckle up, hold on tight. Agoraphobia, the fear of crowded or empty places, crowded place, empty place, supermarket, stairwell, is a disorder of the balance organ. It is not a psychological disorder, it is a disorder of the balance organ. Because in this situation, the eyes, which compensate for the malfunction of the balance organ, have no opportunity for a short time to fixate on an object. Our body tries to compensate for self-damage. It does this very well, and in the case of the balance organ, it mainly does so through the eyes. This requires that the eyes function well and that I have a fixed point. This fixed point is capable of suppressing dizziness. This is referred to as fixation suppression. So I look at an object or my finger, and at that moment, for example, for someone who has severe balance problems, it comes down again because the eye is superior in the hierarchy to the balance organ, the semicircular canals. And this way you can quickly determine if a patient has a disorder originating from the ear. Only after the patient is actually healthy again and the main problems are gone. Wir sehen and einzig the hearts and the eyes have taken over the whole thing. And then the doctor says, if anything remains, yes, that's the anxiety. That's the anxiety because you always had dizziness, but the dizziness is gone. You know that yourself. Yes. Exactly not. Not exactly in a full place, empty place. Supermarket, stairwell, and from light to dark or from dark to light. Our eyes need a certain amount of time to adapt, to find a new focal point. That's why moving images are very difficult, which we use, for example. The eyes, which we will get to, play an extremely important role. The movement of the eyes also plays a role here. And let's imagine we had an eye movement disorder, for example, due to a disturbance in one of the eye muscles or something similar. Then conversely, this directly leads to dizziness again. Some things we could not heal, but we could explain the connections to the patient. And when this patient knew that at the moment he went to a crowded place, empty place, supermarket, stairwell, he simply did not have to be afraid of falling, but that he could calmly, that doesn't even take 30 seconds, it takes a few, 1, 2, 3 seconds. Or to abbreviate it, for example, when he walks across the marketplace, he looks for a fixed point at the end of the market, church tower, town hall clock, whatever, so that his eyes have a steady point again and the balance organ can regain control. That is already very important information. I dare to claim that the diagnosis of agoraphobia does not exist at all, because with every exclamation mark, with every patient who supposedly had agoraphobia, that is a fear of large spaces, a disorder, a measurable one, objectively determined with instrumental methods, so not influenced by the patient, a disorder of the balance organ was found.
And this disorder was compensated through the eyes.
If there are medical colleagues present here, or also neurologists or psychiatrists, then they will agree with me that this diagnosis of agoraphobia has probably been made by them more frequently. Or psychogenic dizziness, or psychosomatic dizziness, or functional dizziness. It basically just means, okay, the patient is dizzy, I believe them, but I don't know why, so it must be the psyche. Or stress, or menopause, or trouble with the kids, maybe the loan isn't paid off, you don't know. All these points lead to wanting to get rid of this troublesome problem oneself, because in fact one did not learn in studies what causes there are, and above all what can be done about it. Those who work with patients experiencing dizziness, including alternative practitioners, physiotherapists and osteopaths, will be surprised at how much better a patient feels. First, when they realize you believe them, you are probably the first person who does. Because everyone else they told, including the spouse or the family or friends, they don't believe it. They say, you already went to the professor wherever and he said, Yaki, you have nothing, you're imagining it, it's menopause, it's hormones. It was with our patients that we treated, and we had a practice with a high throughput, and because we dealt with patients with dizziness, I took over the practice with approximately 30,000 patients. I gave up the practice with about 80,000 patients, because most who came to us only needed to come once. And we conducted a survey with them and were able to help 80% of all hopeless cases by having them sit down and buckle up. Those were people who were everywhere. So of the hopeless cases, we could help them with a treatment. We did not cure them. We told them what they have. We explained and showed them what they have. We measured what problems were there, and we gave them tools that we will learn together here to bring people back into balance. That is the purpose of this course. Respect. Respect for the patient. If a patient tells you they are in pain, then you believe them. When a patient is in front of you and says, I feel dizzy, you say, yes, that's the psyche. Pain patients usually don't hear that. A wheelchair user also usually doesn't hear that they are imagining it, just like a blind or deaf person. Respect. The patient comes to you because he has a symptom. This symptom is something he suffers from. He doesn't initially come to you for healing, because there are also illnesses that you cannot cure. But the least your patient can expect from you, no matter your specialty, is that you believe them and do not judge them. That's why also the name of this book, Dizziness is Not Fate. You can find all the books at ElevenLabs TV, and this book is a good start because I have included many pictures with explanations in it.
And this book used to be given as a gift to our patients in the practice.
That means every patient who came to the practice received such a book as a gift, and in these books they found all the examinations we conducted with them and similar information. Additionally, they received their complete diagnostics and a therapy concept, specifically an individual therapy concept that did not match their particular form of balance disorder. I would recommend to everyone, even if you later need the book from VertiExpert, to get this book as an introduction. Dizziness is Not Fate is available at besserleben.tv shop and is also available in an Amazon edition on Amazon from now on. But at besserleben.tv shop, you can get it directly from me. And there are also other books on this topic or other topics that I deal with. You owe it to your patient to take them seriously. I think that's what you would want to when you go somewhere. Dizziness is usually something that can be treated. There is hardly any system in the body that has as many spare parts as dizziness. Even for people whose balance organ has completely failed due to, for example, the effect of a toxin or an antibiotic, there is the possibility to help these people with training and by explaining to patients what they should do better and what they should avoid. But you also have to be honest with the patients. You shouldn't promise them the moon. So if someone wants to become a tightrope walker and has a toxic injury to the balance organs from the effects of antibiotics or something similar, then you can only say, I'm sorry, you will not become a high wire artist anymore. But there are other things you can do, and that's dub. The patient must learn, and also we gave this a very special focus in this book. The patient must learn that he himself, his best medicine is that he himself is his best therapy. And we have sent patients to physiotherapists only as a supplement. Dear physiotherapists, sorry, even though you all certainly do a great job. The only problem is that many of the patients, and you know this yourselves, you will confirm it, when they are with you, you give them exercises. You tell them to practice at home, but they don't do it. And this must be made clear to the patient. It is not enough to go to the physiotherapist once a week. It is not enough to do dizziness training only occasionally, but it is like a child who wants to learn to walk. They learn every day. It learns every day and often falls down, and suddenly it walks, and suddenly it stands, and suddenly it crawls. Hope justified hope. Explain what it will work in, what is disrupted, and how we can actually compensate for what is not functioning properly. Because at the moment the patient understands that, and that's why the idea for this book came about, which is why I wrote it back then. It's already, I don't know, this is the 4th edition by now. Amazon is technically the 5th. But there's nothing different in it, so you can just take this one. Giving this knowledge to the patient so that they understand it themselves was crucial for me. That's why there's this course, VertiExperts. I hope, and please tell me in the comments if I'm right. I try to explain everything in a way that you can understand even if you haven't studied medicine or have no prior knowledge of it. And I try, if possible, to avoid medical words or terms or to explain them afterward. This means we have an absolute learning process here, and also a learning process for you, dear viewers, dear participants, that the eye plays a gigantic role in this system. Eye, ear, body, receptors, feeling in the fingers, in the feet, in the cervical spine, all of this works together here. And if even at one point this system does not function properly, then we enter into uncertainty, into an imbalance, and then we become afraid because we do not want to fall, because we are not clear about what is happening. People are afraid of a stroke, of a tumor, of whatever, heart attack. It does not matter. That is totally unsettling. We need balance, and it is so what is taken for granted that one has balance. There is a nice saying that goes, health is the crown of the healthy and only the sick can see it. And the choto koina. Calm your patients, listen to your patients, and explain to your patients what is wrong with them, what is not right, because otherwise the following happens. the patient gets caught in a spiral and starts to doubt themselves. Very bad. And every patient needs self-confidence. It doesn't matter at all whether they had a stroke or something else. But through this thing, you're imagining it, we take away the patient's right to this illness. And he doesn't want that. Dizziness is unpleasant. It is, as Oppenheimer said, a feeling of discomfort that arises from a disturbance of the body in space. Even someone in zero gravity will experience dizziness. Someone on a ship can get dizzy, or someone who has been on a ship for a long time and goes back on land and then partially can't shake off the feeling of the waves. And that is indeed a dizziness condition that we will be dealing with. It's called mal de débarquement syndrome. Dizziness just wants to protect you from falling. Dizziness wants to give you the signal, watch out, my receptors are not working properly at the moment. It's better if you hold on to something. That's what dizziness wants to tell you, or dizziness tells you something is not right with your body. There is a risk that you might fall and get hurt. I don't want you to get hurt, so please check what's going on. That's it. And so we will work our way up this ladder step by step, because you see, the whole thing is a bit more complex. You can't just handle it all at once. And that's why it's not only for doctors, for therapists, but it's very important for relatives, not even for the dizziness patient themselves, maybe for them too, of course. But the relatives are the ones who judge him, who say, you have nothing, stop bothering me with your dizziness. We need an understanding of the anatomy. We need to know why our balance organ looks the way it does and how big it really is. The balance organ is not even that big. It is smaller than a 1-cent coin. That's how small this system is. And it is located in the most stable bone of our body, the petrous bone, because it is so incredibly important for the body that it protects it with the strongest bone. That is one of the greatest treasures. It is in the thickest safe our body has ever had. When we look at our ear, we see that it is responsible for very exciting things, among other things. And we all know this, for example, for hearing. That means the sound waves hit the ear from the outside, and make the eardrum vibrate here. And attached to the eardrum are small auditory ossicles, which in turn are connected to muscles, and these muscles can stiffen the auditory ossicles or allow them to swing more freely. And then the whole thing is transmitted via a bone, a very tiny bone, to this blue inner ear. And that is a combination organ. It is the balance organ and the hearing organ. The two belong together, they cannot be separated. And in fish, for example, it is even the same organ. That means it is not separated at all here. And then there is a fluid that moves in this ear, but it can also actually move towards the balance organs, especially if something is anatomically wrong, like a so-called semicircular canal dehiscence. I will also explain that to you, and you will find it in here. And these are the functions that the ear, among other things, has. And then we have these semicircular canals here, which you see a bit larger here, and they are there for us to perceive when our head turns. And what we felt at the beginning of my lecture was, when I move like this, then the horizontally, the fluid in the horizontal semicircular canal moves back and forth and causes a feeling of dizziness, which arises because the fluid in the canal is very sluggish. It is like oil, and it is slower than the rest of the head. That means it follows a movement. If you take a water bottle and turn it, then the water inside stays still for a moment before it starts to turn. So the fluid takes a moment to follow. And as long as it moves, this stimulus is triggered in the ear. And you see, if we look into the ear, if we take a look inside,
then you will see that all these parts are actually connected through small channels. You can see this here in this anatomical drawing. This would now be the inner area where these fluid spaces are, and we see here expanded areas which are called ampullae, and inside are small indicators that give different electrical signals depending on the direction they are deflected by this inert fluid. And for the whole thing to work well, we need our brain. That means the brain is superior to the matter, but it is actually much slower. And there is a part of the brain that is particularly crucial, and that is the cerebellum. The cerebellum is roughly what a capacitor in your radio would be, which reduces excessive voltage and ensures that the voltage remains stable somewhere. The cerebellum coordinates so that things don't happen abruptly, but rather that everything runs smoothly. And the cerebellum is particularly sensitive to, for example, alcohol. So the first effect you notice after alcohol is through the cerebellum. This cerebellum can slow down, it can amplify, and it coordinates, even though it really just hangs there at the back of the ear, attached to the brain. But we will get to the cerebellum. That would be too much for today. The patient must take something home with them from the very first treatment. What they absolutely should not do is simply accept it and not move, but rather it must be made clear to them from the start that their path to healing involves movement. Activity leads to training, through training to neuroplasticity. Neuroplasticity means that our nerves can actually be rewired, can be reconnected. Other areas of the brain can take over tasks they normally wouldn't do, but they only do that if you force the body to do so. Forced using, so you have to tell the body what it has come up with as a help, let's say, going back to the example with agoraphobia, which doesn't exist, where the eyes suppress dizziness. If I want such a patient to achieve losing that, then he may only do a dizziness training with his eyes closed. That means he must feel his dysfunction again so that we can repair everything through neuroplasticity. That is the idea. When the patient understands what they have, they regain their self-confidence, especially when they are taken seriously. And that is why it is so important, because dizziness, in particular, compared to other illnesses, especially affects the soul, because people simply and plainly are not believed because they are simply judged. And the patient must clearly take away from your consultation, from your treatment, that there is a possibility for improvement, that it is not imagined, that he has a right to feel dizzy. And even if you don't know where it comes from, believe your patient, he deserves it. There are simply diseases that you might not know yet, because there are many dizziness disorders that for some people, like I mentioned the word canal dehiscence earlier, almost no one will know that. And you might not even need to. But you need to have an idea of where the problem might lie, and then perhaps refer him to someone who has set up such a specialized clinic. But unfortunately, even in the specialized clinics, and I'm going to make myself unpopular again, there are very often people who have no idea what they are doing, who do not understand how their measuring devices work, who have no one to teach them how to recognize errors in the measurements. So many people have come to us bringing measurements that were clearly conducted incorrectly. And every audiologist or hearing aid specialist or similar will agree with me that many of the hearing tests they see from doctors' offices are grotesquely wrong. Why? Because the examiner has no idea what sources of error there are with an audiometer, what thresholds exist, when masking should be applied, when noise should be introduced, and many other things as well, but I'm probably not telling you anything new. But I might be telling you something new when I say, quite simply, the key usually lies with the patient themselves, who must become active again to break out of their vicious cycle of withdrawal and Dr. Odyssey, which eventually starts over again until they reach realization. Because when he reaches the realization, he is able to process everything, and then he knows that he can move without endangering himself, that these possibly unpleasant feelings he gets while practicing are worth it because they help him in the end to look forward again, to be successful. And then the patient will also feel gratitude towards themselves. Dizziness is also a very good saying. Dizziness is not your enemy, dizziness is your teacher, and every day is a step back to freedom. Keep at it, no matter what you have. Close your eyes, try to feel the balance. Do it yourself. That means I just stand here, so you can't see me now, but just stand there, let your arms hang, close your eyes and stay standing. And maybe you'll feel like you're swaying, so I'm doing this on purpose now. Yes, and the way you sway, whether you turn in a circle or tend to fall forward or backward, or if your arms go out or something similar, is already a very important exercise. Stand your patient up, let them close their eyes and stay close to them. It might be that they don't realize they're falling. It's also in our case, there was always an assistant behind ready to catch them, someone who can handle it physically. So don't take a 2-meter, 120 kilogram person and put the petite medical assistant behind them who is about 1 meter 50 and weighs 50 kilograms. That doesn't work. Instead, someone who can actually catch the patient should stand behind them and watch how they move, if they move, just standing calmly.
This is the Romberg standing test.
Mega easy, important diagnostics. Patients who have, for example, a central disorder and a disorder in the cerebellum tend to fall backward. Patients with disorders in the balance organ, right and left ear, tend to fall to the affected side. People who have an inflammation also fall to the affected side. Or there are many other possibilities for how this can look. This completely uncoordinated swaying could also be an indication that there is a problem coming from the brain, the cerebellum, the brainstem, or often overlooked from the feet. That means, does he sway even when sitting and closing his eyes? You can try it out. Or is it only when he stands on his feet, as is the case with polyneuropathy, a disease of many nerves, a common side effect of high blood sugar, diabetes mellitus? This is also something many people are not aware of. That was a lot. It took a long time. I only wanted to do 20 minutes. Now it's 32. Okay, how do we continue? Chapter 2. What is dizziness? Foundation start. It goes a bit deeper, but I think today's show was already pretty good. I enjoyed it. I hope you did too. Please let me know in the comments if the sound is okay, if it's good, how you like the slides, and recommend it to others. Nah? I mean, as I said, it's a free course that you can attend. You have the opportunity to watch these videos repeatedly or download them, and maybe you can, or my idea is that as an old hand, I pass on my knowledge to the next generation so that more and more people understand what these people suffer from. And these people really suffer. And these people especially suffer from the fact that no one believes them. And try to put yourself in their shoes. If you really have a condition and you run from pillar to post and no one shows you any understanding, but instead they laugh at you. They say you are afraid of large spaces. No one. In all the time in my dizziness clinic with over 50,000 patients that I have seen, I have always dismissed the diagnosis of agoraphobia. I have always found the cause for it. No one is afraid of large spaces. It's something to think about. I wish you a wonderful day and I am happy if you enjoyed it.